Welcome back to Studio 701. Whether you play sports or not, you want to protect your body from injuries.
And Andrew Johnson with Physical Therapy and Balance Center is going to let us know how to protect those knees and what to do if you do have an injury.
Andrew Johnson joins us now from Physical Therapy and Balance Centers. Thank you so much for being here today.
Good to be here.
All right, so we're talking about knee injuries, something I always worry about because they are so tough. So what are some of the common knee symptoms or injuries that can happen during especially winter sports?
Well, when an athlete usually comes into the clinic, the main symptom is pain. And that can pop up in a multitude of different facets in the knee. I mean, the most common places are like the medial joint line, lateral joint line, behind the knee, and kind of around that kneecap. So, and this can be pain felt in weight bearing, running, jumping, landing, deep knee bending, twisting, all of those kind of things. And there are four main kind of pain generators of the knee, if you will. The first being ligamentous, second tendons, third meniscus, and fourth surrounding muscles. So the ligaments provide a lot of stability to our knees. And the first couple, ACL, PCL, and those kind of cross on the inside of the knee. And then we have our MCL and our LCL on the inside and the outside. And then we have a lot of smaller ligaments called our patellofemoral ligaments that stabilize that kneecap. So sometimes we can get a sprain or even some tearing in these ligaments that can cause pain.
There's a lot that goes into our knees, it seems like.
Yeah.
Andrew, how are these injuries treated, you know, when we do get injured in that area?
Right. So the first thing that we look at is try to decrease the pain and inflammation in the surrounding knee of that athlete, because that's what they're usually coming in for. So there are a lot of different manual techniques that we can do, like massage, stretching, ice, heat, ultrasound, even dry needling, to loosen the structures around there to help the pain go down and the knee bend better. And once we get the pain down there, we can start implementing more strengthening exercises and eventually progress into more sports-specific exercises so that athlete feels 120% confident to go back to their sport that they're playing.
Yeah, which is so important. And we always want to be proactive rather than reactive. Do you have any tips for athletes to prepare to take care of their knees before there is an injury?
Yes, absolutely. The number one best thing that any athlete can do is a solid off-season training program. And that kind of encompasses everything athletics, like speed, agility, strength, endurance, flexibility, the whole 9 yards there, with a strong focus on hip strengthening, specifically lateral hip strengthening, because your hips are your dynamic stabilizers for your knees. So if you can kind of encompass all of that in that off-season training program, you're going to be good to go.
Okay, well, good information, and people should definitely make sure they go see you, Andrew, if they have questions about their knees. Thank you so much for your time today.
Thanks for having me.
All right, and Physical Therapy and Balance Centers, if you'd like to contact them, call them at 701-751-3001, or you can check out their website, physical.com.
Stay tuned, because next